Welcome to Health and Wellness. My name is Dorothy Ainembabas. It is a beautiful Saturday and Merry Christmas to everyone who's watching us right now. In the studio today, I do have Dr. Mwesi Derek. He's an orthopedic doctor. And today we'll be discussing arthritis. What does it mean? What is it? What are the causes? What are the symptoms? And what more do we need to understand about arthritis? As we are going for this festive season, I know all of us are going to eat meat, fish, call it whatever you want to name it. But the doctor is here to remind us that this disease won't let anyone go, but unless we really understand what it causes, how it comes about. Welcome to the show, doctor.
Thank you.
How has been your weekend?
The weekend has been tiresome, you know.
You're not in the mood of Christmas. I expected you to, to be like, how long is this show so that we go for and continue feasting?
Headaches our Christmas. Even you might be enjoying your lunch, then
they get
you
a
get
call.
a call that there's something here you need to handle. Welcome
to Bethany TV.
Thank you for staying.
Okay. So today we are discussing about arthritis. What is arthritis?
Arthritis is a degenerative or is degenerating bone joint condition that affects most joints, and it starts with a state of discomfort. Then it goes to severe stage when you feel too much pain in your joints. Then eventually it goes to inflammation. That's why the term comes in that arthritis, because arthritis it's like joint inflammation. So when it reaches that stage, you'll find that the joints have started even swelling. Yes.
So it is a bone.
Yeah, it's
a bone-related disease.
It's a bone-related disease. Because it affects bones at the joint sites. Okay. Yes.
Are there types of arthritis?
Yeah, there are types of arthritis. Although the most common one is osteoarthritis. Is osteoarthritis. Okay. Is the most common one. The osteoarthritis, then there is rheumatoid arthritis. Rheumatoid arthritis, one of arthritis that usually is inherited. It can be inherited that one of the parent might be having a rheumatoid factor. So when a child inherits that factor, you find that child is prone to develop what? Rheumatoid arthritis in the future. That one is a type of arthritis whereby it's common even in young age. You find that a kid is around 15 years, 12 years, but you find that kid complaining of joint pains. Usually, when you see features of arthritis in that kid, you can recommend to do a rheumatoid factor test, and they check whether he's having the rheumatoid factor in his blood or genes. Okay. Yes.
So which one is the common one?
The common one is the osteoarthritis. Is the most common one, because that's why you find that in the elderly, you will see that in the older age, that's when most of the people do complain of joint pains. You find that the knee, it is common in the knee joints. Yes. So you find that in the elderly, they will start complaining of what?
The knee.
Joint pains, mostly at the knee area. Or rarely, you find that even elbow and even the hip joint, those are the most common joints that arthritis do affect.
Okay.
Yes.
How do I tell that now arthritis has come? Do I wake up and the pain starts coming? Because now that you've told us the types, which are two.
Yeah.
Or they could be many.
There are around 5 types of arthritis.
Wow.
There is septic arthritis.
Which is that one?
Septic arthritis. That is a type of arthritis whereby you hear the term septic. So septic is like infection at a joint, at the bone, usually the bone at the joint site. Okay. You find that the bone has been infected at the joint site. Usually, mostly the condyles of the bones. Condyles are those endings of the bone.
The endings of the bone.
Yeah, that's where the cartilages do sit.
Yes.
So find that someone, that part will be infected with either bacteria. The most common one is bacteria, because it's one that usually causes sepsis. So find that the bones are infected by their mycobacteria called, their bacteria is called Staph aureus or Staphylococcus. Then mostly Staph aureus is the most common bacteria that usually do causes bone infection. So when it's infected, when it has infected the bone at the joint site, usually it will bring pus, and then you'll find that that infection will go on expanding to the upper part of the bone. So that one will end up bringing septic arthritis, that the joint will swell, and the bone will also be will start swelling, because it usually increases size because pus will be inside that bone. So it will usually increase in size, then again it goes to the muscles, the infection goes to the muscles around the joint, then to the tissues near to the skin. Then after, sometimes when it goes into a severe stage, that part will form a sinus at the knee, either at the knee joint or any part of the joint, any other part of the joint. So find that a sinus, it's like a wall. It will make a tiny hole that then pus will start getting out. So sometimes even with bone tissues. With bone tissue, those are sequestrums. Sequestrum is like a dead bone. Since that there's infection, even the bone will start dying.
Starts cracking,
it makes tiny particles that usually get out through the sinus. So that is septic arthritis.
Wow. Thank you so much, Doctor.
Welcome.
There are so many. Arthritis is the disease. Is it a disorder, a disease, an infection? How do you term it?
I think it is a disease.
It's a disease.
Yes.
Okay. If you've just joined us, this is Bethany TV for Health, and today I do have Dr. Mwesi Derrick, and today we are discussing about arthritis. If you have joined us late, we talked about what is it all about and the types. That's where we have been, the types of arthritis. One of them are inherited, some are infection, some I think it comes with damages, or if you fall down, incidents that happen, you know, where we walk to or move around.
Yes.
Some of
the causes of arthritis. You know, each type of arthritis, they have their specific causes. When we start with rheumatoid, as I told you, it usually because that someone is having rheumatoid factor, so that one, kizibu nnyo muwona ng'olina rheumatoid factor, eba risk factor okuba ng'omufuna. Then when you go to osteoarthritis, the common one of the causes of osteoarthritis can be age. Age is the most cause, is a risk factor. I can say it's not a cause, but it's a risk factor, because there are people who are elders, but they don't do what? They are not facing osteoarthritis.
Yes.
So it's a risk factor that whenever we grow, our bones do start to develop degenerating conditions or degenerative conditions. Degenerative conditions, those are usually those are conditions that do come because of age, whereby your bones start getting they start wearing out. When you hear that, when you hear all things mechanical, that your tire, your brakes are started wearing. So it's even in the bones it happens, because since we have used your bones for a long time, okuva mu myaka emito, ozo okola emirimu egy'enjawulo, ozo okutama, ozo obweta omugongo gwo, ozo okozesa nnyo amaviivi go, nago gatandika amagumba agali mu nnyindo ne gatandika okukola ki? Okunafuwa. Kati amagumba ago, usually most osteoarthritis, it's the cartilage that is affected usually, most osteoarthritis. So ojja kwesanga nti cartilage zigenda tandika okupeelinga off ku gumba. Wano kubanga cartilage like the shock absorbers ez'ennyingo. So buli wogenda ng'okulirira nazo zigenda zigwerera ku gumba. So buli bu cartilage bwe bugwerera ku gumba, you find that amagumba gajja tandika okubanga gekoona. Ojja laba nti ne joint space, if at all we do the x-ray, ne joint space wakati space eyawula amagumba eri awaggulu n'eri awansi ekendedde. Buli weekendeera amagumba gano gaba it's very easy okubanga geekoonako. Era wekituukamu eyo stage ojja kwesanga ng'omuntu atandika reportinga sound, oluusi nga wulira amagumba gakola weird sound, making that sound that a cracking sound, waba nga atambula wa taking steps. So naye nga kijja lweyo ensonga nti oba nti ogenza okulirira. Then wabayo ekijja nga it's not because of age, nti oba wakozesa nnyo amagulu go. There are times like in sportsmen, oyinza oba those sports injuries, even any injury, because a sportsman waba injury gyafuna naawe omuntu osobola ogifuna in orthopedics. So ojja kwesanga nti oba omuntu wali omenyeseeko around in there are fractures we call compression fractures or stress fractures. Oyinza ofuna injury n'otagitwala nga kiri serious.
Ngezo tulaba ku TV.
So goyinza obutagitwala nga ekiri serious, kumbe there was a fracture line mu gross plates awatera obeera cartilages. So gwe n'ogireka with the time cartilages zijaba zifuna obuzibu. Ojja beera at a risk of getting developing osteoarthritis. Then ebirala causes waliyo gundi weight y'emibiri, nti ebiseera ebisinga buli tubanga omuntu nga yali overweight ngoba munene nnyo, obuzito obwo bwonna bwalina obw'omubiri gwe buba bukka mu joints zino zezibuwanirira. So ojja kwesanga nga is among the joints that do bear the most weight ey'omubiri. Tikati buli webanga weight eyo buli webanga eggwera mu viviriri, gatuuka ekiseera ne gabanga nago geekuuta. Kati awo osteoarthritis n'oba mwana muto nga weight yo si gy'olina ositula omubiri emyaka gyo. So gana amagumba g'oteekako ki weight yo yonna. So at the end gajja mwaliza nago ga developing arthritis olwekyo nti cartilages jatuuka zicrashing, then amagumba gatuuke bone to a bone, joint space reducing, then you end up developing arthritis. Then waliyo ne gundi, wabayo ne gino emirimu gye tukola kati usually kati arthritis ow'emigongo, kubanga abantu abasinga twogera ku arthritis balowooza nnyo ku bivi, naye nga arthritis yali joints zonna ez'omubiri zisobola okufuna arthritis. You find that the ankle joint, it has osteoarthritis as well. Even these tarsal joints, metatarsal joints, phalangeal joints, they all also develop osteoarthritis, even other types of arthritis. So waliyo wetugenda kati ag'omugongo, amagumba joints z'omugongo, emirimu gye tukola nti oba okola nnyo emirimu naye ng'okutamiza omugongo gwo. Buli wokola emirimu ng'okutamiza omugongo gwo, ojja maliriza nga buli wokutama bw'oti kino amagumba, buli wokozesa nnyo omugongo gwo ng'okutama fine, woyimuka gaddayo. Naye there are some few millimeters eziyinza osigala waggulu oba wansi. Ojja kwesanganga nti ezo millimeters buli otugenda nga buli n'okikola ng'oddingana omwaka ku mwaka, ojja kwesanga nga waliyo millimeters ezayambuka ennyo, ezakka ennyo wansi. Okiraba? So zino discs ez'amagumba nazo kuba discs those are cartilages. They are cartilages bibeera wakati waago amagumba g'omugongo. So nabo bugenda tandika okuba nga bwekuuta directly. So we end up developing arthritis owaga amagumba, kyekimu even in other types of joints.
Kati dokita tetukola emirimu tetusimbula enyuma okay
twatusobola obikola naye nga tubikoze in the right way
okay
nti oba ebintu byonna ndowooza olaba abantu abattisibwa obuzito those people abattika obuzito you'll find them that when ng'agenda okajja wansi they don't bend their backs.
I noticed.
Yes.
You know, when we're in the gym and lifting, there's a way they tell you to bend.
Yes.
Katugobol was into your social media.
And it's very easy to carry that kazitongo muntu akutami.
Yes.
Because you find that when you bend like this, it's very easy to castura. But they go in a proper way, which it's among amateeka.
Yes.
Bakikola okubanga it prevents
the breaking of the bones.
Kubanga bafuna damage ku migongo gyabwe oba developing ebyo conditions. So akawansi bwati asitama, you see that the back will remain nga eri upright. Najjayo kana akazito bwati nakakwata mu mbirizi then nayimuka nako nayambuka. Ne wokola about you causing
you're affecting the back.
You're affecting your back. Then even the joints as well.
Wow.
Kwauza mavivi gegamu kubijositula eyo weight. So byonna oba obi affecting lamu. So kyekimu n'oba kati ekyo nkireese you also relate it to your normal lifestyle ewaka.
Okay.
Nti kapeni kajja gwa wansi someone
okay.
will just bend. You get.
Hey.
Whether it's better. No, sitama wansi.
Doctor.
I'm trying to gamba ima.
I think the only way we are not to sabotage or to affect other people in the category of pregnancy. Maybe we were killing muko. Ninga chali fit. I can just speak a bit.
I'm fit. Let me just. But it's good. You know, orthopedic conditions. It's like discipline. You have to be disciplined.
That's true.
Yeah. You have to be disciplined in your lifestyle. Okay. Pain a good one. So let me just nail then nyijo pain.
Tebakaite kajaja doctor.
Ajazita ate visa.
Anyway, you're still watching Health and Wellness. Dr. Mwesi Derrick is here. I'm just enjoying this show. Arthritis is a very serious disease. Until it affects you or the person that you know or a loved one, that's when you'll see how much money you spend in treating something that would be avoided. Doctor, I've seen people that get affected with the arms. What would chechirete is ngalukutandika okuchuka?
Nga zikyuse zitya?
Zitandika oku breaking anabyo. The arms. Is it because they also lifted something?
No. Kati usually abo kijja mu bantu nga abadde oba asitula nnyo ebizitowa mu mikono. Zino emikono omuntu ayinza oba asitula ebizitowa oba nga akola nnyo kati nga onalaba nti abo bankanda ngano ekitegeera ebiwe bito.
Dr. Abachapa togenda batiza. Okay. Okay. Thank you so much.
Nenga usually arthritis affecting obwala asinga okuba obungi it's rheumatoid. Yasinga oku affecting nnyo joints z'emikono za fingers z'ende couple zinaye nga zo tezanyobera affected no osteoarthritis. Arthritis are common nnyo mu elbow, hip, then knee joint, ne ankle.
What are the signs? Joints. Kati kitegedde ofuna obugumba amagumba gatandika oku wearing off. Kati okitegeera otya mbu kati now I need to see a doctor. I need to see Dr. Derrick.
Yes, okukitandika okiraba. Buli otandika olaba nti usually omu ku bubonero mu osteoarthritis ojja wulira nti otandise owulira pain mu vivi naye nga twekoonye tewagudde ekigo wansi tewakozire n'otandika owulira pain mu vivi eyo. Ese ebisinga ebeerawo nnyo ng'omuntu annyuse lwansonga aba akozeseza nnyo omubiri. So kati pain eyo etera nnyo ebeerawo ni evening hours. Yes, so awulira nnyo eyo pain. So kati wotandika owulira pain naye ng'ejja nga sinti oba wafunye injury, sinti oba wagudde ekigo.
Si kubanga otambudde nnyo.
Kati woba otambudde nnyo n'oddayo ewaka n'owulira pain, then you suspect that your arthritis, you have started developing arthritis. So ojja kwesanga nti wabayo abamu nga reporting obulumi ngalinga alina loose pulse. You find that someone will report that pain as if he's having pulse. You feel that pain, you feel like you're having pulse in the knee joint or in any joint that pain is. But when pulse is not there, yes, usually it's like a burning pain. You know, whenever people feel that burning pain, they're like as if I'm having pulse in my knee joint, or I'm having pulse in my ankle joint or elbow. Kumbe, it's not pulse, but it's that pain. Usually, whenever the cartilages start peeling off, they leave some tiny wounds. So those wounds, they usually report with that burning pain. So you feel like you're having pus inside, but ideally it's not pus. Then other signs will start. Sometimes when it comes in severe stage, you feel when the knee joint etandise okuzimba. Usually in osteoarthritis it's not common, but in rheumatoid the joints will start to swell severely. Then another sign, you will start getting that cracking pain. Usually when you are staying with elderlies, you find when they are walking, you find that there are signs, there are sounds they make. So you start reporting that kind of sound in your joints. Sound. Then those are the most common causes. Most signs.
Dr. Banabakola buno obuntu. Tebaleetere tufunewo obulwadde. Nze mbutya.
Yeah, kituufu. Busobola ovaamu nabwo arthritis. Abantu cause you are overpraying a joint. Kitegeera. Ate oli making okola weird sound. Buli weekola weird sound, that sound esinga obasanyusa buli weekola sound. But it's like you are crushing cartilages inside.
Really?
Yes. So people enjoy it, but obo crushing cartilages mu joints, oba zobo okosa munda muli eri. So it's not good. Then tukyali ku causes wayogeddeko ku nkondo neerabira.
Enkondo tozogerako nnyogera katono.
Kati enkondo ezo si kibi okuzambala, naye buli wozambala ennyo n'ozeemanyiiza zisobola okuviiramu kufuna arthritis ow'omuki ankle joint. Because remember, these bones, the weight yonna ey'omubiri erina kujja ejja mu mubiri. Then the knee also bear. Then after the knee, the foot will bear. So whenever the foot egenda kuba slanting bweti. So whenever the foot is in a slanting way, that means weight yonna tegenda kujja formula ku ground. So that means you overstrain your foot. And whenever you overstrain your foot, even the ankle joint is involved. So whenever the ankle joint is involved, you find that you are affecting more. When you are affecting more, you are overstraining it. You are standing high chances of developing what? Arthritis.
Okay, yeah. Thank you so much, Doctor. We are going for a short commercial break, but we'll be back. You're still watching Bethany TV Health and Wellness Show. My name is Dorothy, which airs every Saturday from 8 to 9 p.m. But do remember, we do have a repeat every Sunday at 12 p.m. I'm still in the studio with Dr. Mwesi Derek, who is an orthopedic doctor. Exactly, but we shall be knowing. Before and for a commercial break, we're talking about the signs of arthritis and some of the causes: overweight, it should be one of the lifestyle that people should watch out. Now that we have talked about the causes, how can we manage it so that one can prevent to have, you know, arthritis in their body?
Yes, thank you. How to manage, or we can start how to avoid.
Prevention is better than cure. Yes, doctor.
How to avoid. Since I've heard that some of the causes ezireta mulimu weight, mulimu activities zetukola. So kati how to avoid arthritis. Wabayo emyaka kale wotasobola kumwewalira nti asobola okujja naye nga omulimitinga otya okubanga ajja. One of the things, activities zetukola zensinga oyagala okubanga ntandiika nazo, oba okola activities oba okutama nnyo ku mulimu musa arthritis w'oku mugongo, oba okutama ng'okola emirimu gye gya bulijjo, it's good to know nga you remit overbending your back whenever, like you're picking a pen, picking those small things, over picking objects or likoza bintu, you can sit once, you get a mat, you sit down, then no nama you no nama.
Doctor Bolanda boyo zebitu.
Yeah, you nama then you wash your utensils. Over situation, those people abalina modern kitchen.
Oh, that's things.
Yeah, in the modern kitchen, you can just do what? You stand.
Oh, yeah.
Yeah, you wash your utensils while you're standing.
Okay.
Or fumba or imiride.
Yes.
Yes, like that.
Mopping cut.
Even mopping. They are like that.
Even sweeping.
Yes, sweeping.
Life has become really soft.
Yeah, very soft. So, kati awechti okola bwotyo ng'omugongo gusigadde guli upright. Then okupanga obuzito bwetwetikka wobanga olina ebintu bino oba okola emirimu tugezeeza okusitula, wabayo abantu ng'asitula yeetikka ensawo ya sukaali kilo 10, ensawo y'omuceere kilo 10, kilo 5, eyo yonna weight at the end ejja kuba kiva omala ogisitula, you feel too much pain in your back, then even the knees.
Yes.
So kitegeeza eyo weight at the end, your bones are the one that bear that weight.
That weight, okay.
So kiba kirungi n'oreducinga ku buzito bw'okola ki bw'ositula. So mu gundi usually kati muzina activities waliyo gym work, abantu baagala nnyo kuba gym.
Baagala okusitula.
Ne wabayo si buli nti exercise eba ya mugaso gy'oli. There are some exercises nga nungi, gym nungi. Sayagala ate abantu bagambe nti dokita atujja ku gym. Gym nungi. But there are some activities zotalina nnyo kukola okusinziira ku myaka. Kati wabayo emyaka nti tugenda tubeera mu myaka z'obukadde, myaka 5, 45 okudda waggulu, babeera at a risk of getting arthritis. So wobeera mu gym, don't overuse your knee joint. It's not always good to overuse your knee joints, but do those activities that will try to reduce your weight, those activities that will try to reduce the fat in your body. Yes, because but don't do those activities do cause tense that are very tense to your joints. So wabayo abantu kati nga akolanya activities nga azanyisa nnyo zino knee joints ate nga ali mu myaka. So ogenda owulira nti buli okola ezo, I think you have heard that ka sound. Yes. So buli okola ennyo, you are exercising your knee joint. The more your cartilages are doing what?
Affected.
Yeah, so it's better nemukola exercises ku myaka, sinzira ku myaka 45. Do those exercises, push-ups. Togenda ku affecting joints nyingi.
Sigeza muzeji yatulaga yali fit.
Yes. So you will reduce your body weight. Ojja kendeeza ku lubuto, ojja kendeeza ku fats in your body. Then the diet. Let us revise on our diet.
Yes.
Nti kulya woba olya toteekamu nnyo fats like fat intakes.
I think I've hosted all doctors on this show, and the thing has been lifestyle.
Yes.
Lifestyle.
So lifestyle causes many conditions have developed because lifestyle changing. Tuwabayo conditions nowadays ezeyongedde, but nga bajjajja baffe tebazirinanga. Yes, naye nga these days eyongedde because of the lifestyle, engeri gye tulyamu. Ojja kwesanga omuntu kizibu okumala olunaku nga talidde kintu kirimu obutto.
Sure.
So kati whenever we put kati lifestyle eno engeri gye tulyamu diet kiba kirungi n'okendeeza ku fat intakes. Mwezo mulimu okulya ebyokulya nga pork cause birina nnyo fats. Ebyokulya nga kati enkoko erina oluliba lulina high cholesterol levels. Cholesterol levels, those are fats. I think amasavu agali omwo mangi nnyo n'okusinga amasavu agabeera mu nnyama ensava eriko amasavu kungulu. Agali mu luliba lw'enkoko lulina amasavu mangi. So it's good n'oluggyako ate kiri funny nti olusinga ate owoomerwa abantu bwe basinga owoomerwa ku nkoko nowadays. So kati kiba kirungi ekyo. So kati kiba kirungi akaliba ako n'okaggyako.
Ate we bakookya obulungi.
Noba bakwokyeza fats zisigalamu obulungi.
Okay.
So kiba kirungi n'okapiiringa off. So n'ekirala gundi zino ebyokulya ebyala ebiri fat like amata kirungi chipsi mata yogurt kirungi kubirya buli lunaku biri cause lwaki sigamba obiviireko ddala because they are nutritious. Milk has almost byonna ebiriisa, so they are nutritious. But wobeerako nnyo you find that someone ajja ku increasing in size oba ajja kwongera ku weight ye. And whenever you add on weight, that weight will strain the joints on your body. So kiba kirungi no improving a diet in that style. Then gundi what your activity like jogging. When you're jogging, as a jogging activities in the evening, no call jogging will help you okubanga osala your body weight or you maintain your body weight. Yes. So when you do jogging, usually jogging, it's a small kudukamu.
Doctor says small.
So you can even decide to walk.
Yeah,
it can be jogging.
Naye jogging. Abantu balaba bakola dduyiro
n'ogamba otuuyanako entuuyo n'osala ku masavu usually okikola on a daily basis. So kijja kuleetera to maintain your body weight. Then nobanga developing a new weight eyo oba nti oba olidde ebintu ebiri fat you jog n'osala ate gali amasavu g'otaddemu. Yes.
Katutegedde prevention naye kati omuntu wabanga abulina already, is there a solution?
Yeah, the solutions are there. There are solutions.
Is there any treatment?
There is a treatment. Teri kintu kati ndowooza kitalina bujjanjabi ennaku zino kujjako there are some conditions, a few conditions nga obujjanjabi bukyagaanye naye ng'era waliwo obujjanjabi bwe baateekawo kubanga era buyamba abo abantu abalina ebyo ebirwadde nga tebiwona. Yes, so nowadays at least ensi egenda developing a treatment eri buli condition. So in arthritis condition eyo obujjanjabi obusooka bwe muntu gwe kennyini nga wenyonyodde. So gwe musawo we asooka lifestyle nti already in arthritis nti kati kyolina okukola olina okwejja ku bintu ebimu nti like okukozesa ennyo omubiri gwo like okutama nti already omulina kati obutamuwaseninga sooka wejje ku exercises ezimu eziyinza okwongera okumuleeta. Then ekirala fenga mu basawo kati twina there is conservative management of arthritis and then there is a surgical intervention. Yeah, so katwabayo omuntu nga they cannot afford the surgical part eri quicker. then wabayo oli nti waba tosobola gya affordinga, what can we do for that person?
Therapist.
So ojja kwesanga nti kati in conservative management mwetuba ne physiotherapy
yeti eyo
physiotherapy
njewulira bajogera malwaliro
ne physiotherapy wabayo gundi the machines ezikozesebwa mu bantu nga ina arthritis usually ku managinga bulumi nti the exercise ajjo kukozesa waliyo ne machine jajjo kukozesa physiotherapist okubanga now there is an ultrasonic machine. Ultrasonic machine usually it uses magnetic waves okubanga treating pain nti webajja kuteekako those waves zijja kujjawo obulumi munda eri omunyingo yo. Then wali usually omuntu aba na arthritis nti wegenda in severe stage batandika developing muna n'enkobogo cause these joints will start also to loosen. Ebinywa ebikwatirira ennyingo bijatandika reasoninga, so bajatandika okubanga the joints are loose. So whenever they are loose, they become deformities starting either inzotandika developing enkobogo lwansonga ebigere biragaya. So kati usually kiba better tubafunira ka local osteoarthritis knee brace bakabasiba lwakuba treatment esesinga ojogera ku TV abantu bayinza otandika okwejjanjaba
which is true, we usually don't
ate nga si kirungi tugezaako kirwanisa nti oyinza oba gwoluza owejjanjaba arthritis yet is not arthritis kumbe olina ekirwadde kyali kideveloping ate nga kyamaanyi ate n'okiriwo omwaganya okubanga kyeyongera okukola kutulugunya. So kati kani brace kakuumira wamu akakasipika evivi kakuumira wamu evivi eryo. Then it also limits movements, restricts movements as a joint into obuteekosanga okuwa omwaganya eri munda amagumba okubanga gawona aba otubo twakuliyetingibwa ku magumba okubanga tuwona buli kibanga kiri limiting movements ku joint nakyo kiwa omwaganya mwabagali munda okubanga gawona. So then wabayo drugs zetubawa zosijja zoogera
tujja kudduka ku pharmacy
so kati is drugs wabayo drugs ennungi in generative conditions mostly those are COX-2 inhibitors nti aba asobola oyimirira for like 1 month n'afunira ddala enjawulo ate nga terimu affectinze like because there are types COX-2 inhibitors ziyinza oleeta wobeera COX inhibitors tezitera nnyo okuleeta they are ulcer friendly nti omuntu niwabeera na ulcers tezimukosa tezina bulabe ku ulcers. Then there are NSAIDs those are mostly those are abantu ze bakusinga okukozesa ate za bulabe kati omuntu ayinza nafunye obulumi mu nnyingo nadduka ku pharmacy mumpe ibuprofen mumpe diclofenac. Yet those drugs are very very dangerous ku muntu ng'alina ulcers. Ate nekirala zireeta ulcers nazo zennyini. So COX-2 inhibitors are better mu arthritis. Kati bwe tuvaawo physiotherapy namwogeddeko someone will feel a better change kasita abanga naye improving lifestyle yewaka. So kati eri unsurgical whereby conservative nti omuntu oba talina sente zigenda surgical. Kati in surgical we do a joint replacement. In surgical we usually do a joint replacement. Kati jjukira cartilage yavaako. What we do like webanga knee joint we do a knee replacement netuteekamu ekigere netuteekamu ka cartilage akazungu
si kyuma
kiba kyuma. So it's a cartilage akazungu tuteekamu artificial joint akakuuma. Kati akakuuma ketuteekamu yefuuka joint empya nti oba cartilage empya nti kati omuntu waba atambula tajawulira bulumi cause kyuma ku kyuma oba cartilage bagireplacinga ku gumba. So ye surgical intervention
tubikola wano Uganda
yawe ebiri bikolebwa
sina kati kulinya India
toyina genda India kola knee replacement because ne hip joint replacement total hip replacement weziri e Kampala abantu basawo bazikola kati technology agenda Uganda bagenda abantu ba advancing ati tekyakwetagisa genda India ebintu ebisinga we biri wano. By the Ugandan doctors are good, so good.
But before, are there stages, warning signs Uganda kati wano? We can't do surgical. What you told us earlier about the elderly parts.
Kati usually
olwo mukadde ayinza okuba nga ali eyo ali mukulya akakoko ke omugambe tuve kakoko ate already maybe ayina buno obulumi
enkoko mukadde togivaako osobola osigala ng'olya enkoko naye nze nkwaddewo advice nti ku nkoko eyo akaliba ako kaba
fati
kajjeeko ku nkoko then olya enkoko yo then woba togirya buli lunaku. Togirya buli lunaku nti oba wabayo abakifuula daily routine. It's not good. Oyinza ogamba wamu week kandi enkoko omulundi gumu then woba oli mukadde I think tolina kyovaako oba olidde boiro. Kuba nze kati ne ku myaka gyange sinabatuuka nnyo ezo myaka zinzaba nti oba neegendereza nnyo naye nze omuntu ndowooza emmere gye nsinga okulya boiro bulamu bwange. So buli oyo boiro ojafuna that nakyo gundi ey'ekyokulya ky'olya nti tojja beera nnyo affected, tojja gattamu nnyo obutto kubanga nti akukosa oba obulamu bwo mu bitundu ebirala. So si kirungi osobola oba oli mu myaka egyo emikadde osobola okugezaako okuba nga olya boiro
obulwadde n'oba obufunye bo tebeetaaga surgery
omukadde
abakadde
surgery buli omu asobola ogyetaaga n'oba mukadde osobola okukola surgery kasa kiba nti just nti surgery eya knee replacement oba joint replacement they are always very expensive. Usually ojalaba nga surgery will cost you 12 millions and above okukola knee replacement. Kati nga ku nyingiza yaffe abasinga bana Uganda ojja kwesanga nga there are few families that can do afford that kind of surgery. So kati we go a conservative way. If at all you can afford the surgery, it's better. No surgical gone. No going into surgical intervention.
Okay.
Yes.
Kati doctor nga tetunava wano bubaka ki bw'otulekera?
Obubaka bwe mbalekera.
Naye nga tetunava. Any recommendations? Where can one get this health facility services? Yeah. Usually, briefly. My name is Dr. Mwesi Derrick. Kati gy'osobola ofuna nze ndi musawo w'amagumba era facility yange we do the things and it's a specialized clinic ya magumba gokka birwadde by'amagumba. You can find those services there byonna nga wembyogedde. It's authorized services. It's located in Najana Nkumbi opposite FDC offices za BSG just opposite along Entebbe Road. Osobola okunsangayo ennaku ezimu mbaawo enga wetubeera wemba n'oba tonsanzeewo you find someone omulala other doctors benkola nabeera nabo babeerawo. So birwadde bino byamagumba abantu abasinga mubirekerera but they are treatable. Mwebiri muno ebirwadde ebingi nnyo ebyamagumba many Ugandans are ignoring them. Naye nga abakugu waabwe wadde tuli batina abasawo b'amagumba naye weetuli era ojja kwesanga abamu malwaliro ga gavumenti mwebiri ebyuma
gye bali gyera abasawo b'amagumba era gyeri n'ebyuma ebikebera malwaliro agasinga obungi x-rays x-ray machines gyeziri. Yes. So temuggwamu maanyi then ekirala lifestyle mufe ku bulamu bwamu ate olaba ekirwadde ky'amagumba nga kiki ekisinga obuzibu tusinza osanga nti omuntu bwe bafuna ebirwadde by'amagumba abantu abasinga they first treat themselves nti ajasooka agende afune pain killer. So genda olabe omusawo yes you go olabe omusawo w'amagumba alabe investigations zirina okukolebwa akola x-ray kusindike ku x-ray then alabe treatment etuufu gy'alina okuwa. Tojja kuddamu beera na buzibu bwafuna birwadde by'amagumba singa tugenda bwe tutyo.
Kale Thank you so much, Dr. Mwesi Derek. From the Bethany fraternity, would like to wish you a very Merry Christmas and a prosperous 2024. For me and the team, good night.